There's one more imaging technique that I want to talk about, but before I do, I want to mention one more thing about Dexa, which is that because it uses X-rays, it does involve radiation, but it's very, very small amount. I think it's, maybe 1/100th or 1/1000th of the X-ray dose that you would get, say, in a CT scan. So Dexa uses X-rays, but it's a very small dose of radiation. That brings me to the final medical imaging technique I want to talk about, which is something called a bone scan, occasionally also called bone scintigraphy. Scintigraphy. Again, graph for image. Now, how bone scan works is it's kind of like an X-ray in reverse. So what do I mean by that? So in an X-ray, we have this external source of radiation. So you're here, maybe you've got some pain in your shin, and we've got some external source that shoots radiation through your body, and then we take a look at it. How a bone scan works is X-rays come out of your body. You might be wondering how that works, but what you do is you get some chemical that binds to the tissue you care about. In the context of sports medicine, almost always that's going to be bone. And then you inject that chemical into your body. Now, this chemical is going to be radiolabeled, meaning there is some radioactive element, usually it's technetium. It's a pretty radioactive element, and it's bound to this chemical, so it flows throughout your body, and then it goes into whatever tissue it is that chemical binds to. So like I said, in the context of sports medicine, usually we're interested in imaging bone with a bone scan, hence the name. And so you use a chemical that is involved in metabolic activity inside the bone. So why this is useful is that I mentioned this in our X-ray video. Regular X-rays so let's say you're at a sports medicine clinic, and a runner comes in with really bad shin pain, and you take an X-ray and it looks fine, right? Totally healthy, fine tibia. But you know that X-rays can miss things like stress fractures because you just cannot image that the micro damage that is happening inside the bone. So a bone scan is one way to do that, and how the bone scan looks is like this. I don't know how well you can see what's going on here, but this is the lower leg. These are the lower legs of a person. So here's one bone scan image. This is their shin coming down like this. Here's the ankle, and then the foot is going off like that. And then this is just two different views. This is the left leg here. Here's the left leg. This is like the knee. The femurs would be going up like this. By the way, notice, this is why I like to drill that anatomical terminology. We see our medial, lateral, posterior, anterior. All that stuff, very important to know. Okay, so what are we looking at? Well, what we're looking at on this is a higher area of intensity. And by intensity, it's picking up the radiation given off by this radio-labeled chemical inside your body. And what it shows is that there's this area of high metabolic activity in the bone. That's indicative, likely, of a stress fracture or a stress reaction. Now, I'm including bone scans in our content for the sake of completeness. To be honest, most people who are kind of with the times, most doctors who are with the times, don't use these anymore. So bone scan pros, you can image bone metabolic activity. And that's about it. Cons, though, and there's several. radiation inside your body. So radiation. Also, it's slow. This actual acquiring the image is fast, but you have to inject this radiolabeled chemical into your body and then just wait while it circulates, you can an hour or two while it circulates throughout your body and gets into the bone. Slow, expensive, because, as you might imagine, radiolabeled chemicals are not cheap. And it's also, as you can tell, it's really low resolution. Pretty much everything that you can do with a bone scan, an MRI can do much better without any radiation. So today, generally what you do if someone has chronic shin pain and you suspect it might be a stress fracture and the x-ray looks normal, is you do an MRI instead. So compare what we can see at the shin with a bone scan to what we can see in the shin on an MRI. So this, learning to read these things is a bit of a arcane art, but all of this kind of light colored stuff, that is bone marrow edema, meaning swelling. That is indicative of a stress fracture at the base of the tibia here. And this is faster, does not involve ionizing radiation, and you can see much else. So one of the drawbacks of a bone scan is, suppose you have your runner with shin pain and he or she comes into the clinic, the x-ray looks fine, you do the bone scan, and then the bone scan is also fine. Suppose their bone looks like this. Now you are back to the drawing board. However, on an MRI, you might be able to see swelling in a tendon adjacent to the shin, for example. You can see what's going on maybe in the muscle. So bone scan, good to be aware of, just because you might bump into it here and there. You might see patients who have had bone scans. But quite honestly, MRIs and CTs are much more used. So that's medical imaging. I hope you found this useful and informative. Hopefully you'll be able to understand when you see something like this, you'll be able to understand what this is and when it's used.